Caring for a child with functional constipation. 5-year-old Ari has always struggled with constipation. Ari had a hard time with toilet training and still has a lot of accidents. Ari's parents have tried to be patient and have seen their doctor a few times. The doctor mentioned Ari might outgrow it, but with school starting soon, they realized there has been no improvement. Ari's mom worried about what will happen at school all day, so they made another doctor's appointment to get some help. Functional constipation is a type of constipation that happens without any particular physical or genetic cause. Functional constipation occurs when children have 2 or more of the following symptoms at least once per week for at least 1 month: 2 or less poops in the toilet per week, 1 or more poop accidents per week, holding in poop or avoiding going to the bathroom, hard or painful poops, very large poops that can plug the toilet. Most children do not need special testing or to see specialists to be diagnosed. Your healthcare provider can help make sure there is no other cause for the constipation. Functional constipation affects about 1 in 10 children. It is usually very challenging for families, and finding an effective treatment plan may take time. If you think your child might have functional constipation, it is important to talk to a healthcare provider so your child can get better before symptoms become severe. The doctor explained to Ari's parents that most cases of functional constipation do not go away on their own. Symptoms of functional constipation often make the condition worse. The longer poop stays inside the colon, the more water is absorbed, making the poop hard and dry and harder to pass from the body. As more poop fills the colon, the muscles stretch beyond their usual size, which makes it harder for them to move poop out of the body. Untreated constipation may cause the colon to stretch to the point where it can take months or years to return to normal. Always having poop inside the colon can make it hard for children to recognize when they need to poop. Having large poops can be painful and makes children more likely to avoid using the washroom, making symptoms worse. Ari's parents were relieved to learn about why the accidents were happening. The doctor reassured them that the functional constipation was not their fault. Together, they made a treatment plan to help Ari. Effective treatment usually requires multiple approaches and regular visits with a healthcare provider. Long-term treatment can prevent symptoms from becoming worse and helps avoid more serious complications. Most families will need to consider some of the following: a regular routine that includes time on the toilet after meals. Avoid punishing or shaming children for accidents. Daily medications to soften poop, such as Restoralax or Laxaday. Behavioral and mental health supports for children and parents. Regular visits with a healthcare provider for follow-up care and support. They will work on making a toilet time routine to help Ari recognize the signs the body gives when it's time to poop. Even though it's messy and frustrating, they understand the accidents are not Ari's fault. The doctor explained that Ari would also need to take functional constipation medications. Safe medications for functional constipation draw water into the colon to make poop softer. These medications are safe for long-term use. Children almost always need to take medicine for longer than they feel constipated, meaning treatment may last for months or even years to prevent symptoms from returning. This gives the colon and muscles time to return to normal. Ari's parents knew that figuring out the right treatment might take some time, but was important to avoid more serious complications. They made a plan with the doctor to monitor and adjust Ari's medication. After asking a lot of questions, they felt much better understanding the condition. It's normal to have questions about medications for your child. Talking with your doctor about your questions and concerns will help you get more information and feel confident about your child's healthcare decisions. Remember, functional constipation is a common and important issue. It takes time for your child's body to recover and to find the right combination of treatments. Seeing your healthcare provider regularly can help. It's normal for families to have periods of frustration and difficulty when treating functional constipation. Try to be patient with yourself and with your child.